How you doing today?
Good.
I'm Dr. Walt Baguette, moderator. I'm a pediatrician, adolescent medicine, family doctor, assistant professor of family medicine at Howard University, as well as psychiatry. And right now I see patients at Hillcrest Family Children's Center, I'm a PCP liaison position there. Back in the day, I used to run the health department at DC.
That's right.
I'm now the director of DC Medicaid. I've been trying to retire, but my wife likes to shop. This is my boss. This is Dr.
You don't change.
She's mad at me because I missed her. I'm also on her nursing advisory board. Am I still on? I don't know.
In fact, he looks younger than when I last saw him.
But I just had a birthday, so I'm getting up there.
Really?
Okay. And, I have a young wife, so that helps.
Yeah, she makes you look younger.
And like I said, I am doing some work. I'm the past Speaker of the House for the National Medical Association. I've just been here. And we helped with the Ebola crisis in Liberia. And in fact, Ambassador Lunte was so pleased, he made me an honorary Liberian citizen.
Wow.
And so, since that, we now have an organization called CAN Africa Network, chaired by Annie Wright. I'm the chief medical officer for that. So this is going to be my passion going forward. Trying to talk my wife into going to Liberia. Unfortunately, when the ambassador made me an honorary citizen, he told me that once I get my African name and my title, I can have many wives as I want.
That's why your wife don't want to go.
So we have cleaned that.
So you still have to.
So I'm at risk. Okay. Understand that my wife told me that she said you can have the name you afford.
Oh, yeah.
And she says I can't afford her right now. So, but anyhow,
I see why she's shopping.
If you get a real title,
right.
I see why she's shopping.
then she'll be the queen, right?
Yes.
Exactly.
I told her she could pick out the one.
Exactly.
She didn't think much of it. But I'm sorry to digress. As a moderator, we're going to be addressing career in health sciences, public education, health policy, and public health. And I do know that one of our panelists will not be here today. He's a dentist. In fact, did you have that program I gave you?
Oh, yes. No, but it's Dr. Nathan Fletcher.
Yeah, Fletcher. There's another. Today I had to speak at a funeral.
Dr. Martin.
Dr. Fred Martin. He's a dear friend. And I mention that because he was a.
I like it. Sorry, go ahead.
I think just to give our absent panelists, Dr. Oswald Morales, to give fair play, I think in my talk, this is Dr. Martin. I had to speak to Jim today, so. But
You mean he died?
he died, right? He was 85. Prostate cancer, which is I'm so.
Oh my gosh.
So glad to hear some of the things that but I think he is a good example of really he's a DDS, ran some health clinics, but we have a health minister in our church. He was very instrumental, and so he's quite a loss. And I just passed that on, and just to want to mention that we're now appreciating how the whole team is necessary. Physicians are nowhere without nurses, of course, and the dentists, pharmacists, all of the specialties are very critical in the healthcare team. And in DC now, we're having collaborative practice between pharmacy and dentistry, and working on Dr. Broadnax's health advisory in her program at UDC. We're seeing some opportunities to really impact on the continent. We're going to be working on a health system, a mobile health unit that we're going to take over and really deploy. But with that will come health education, prevention, all of that. And this will be a good platform to do a lot of the immunization and things like the HPV vaccination and all that. So we think by having that platform will give us an opportunity to really expand the care and opportunities for students. And now, one of my passions, I have 8 grandchildren, and I have an 18-year-old who's coming to Howard.
Oh, wow.
Pre-med,
Wow.
and her father called me today. It's expensive to go to college these days, okay? He said, do I know of any programs which can help her as she comes into medical school, undergrad, in preparation for medical school at Howard University.
Nutrition.
And we have the 6-year program. You have the 2-year undergrad and then 4 years.
4 years, yeah.
And so we're hoping that she might qualify for that. But to that end, just as your moderator, I just want to share with you that I did testify March 16th on the Hill. We had a group, a coalition. And what we were doing there was trying to save the Affordable Care Act, Obamacare. We had a coalition between the Hispanic Medical Association, Asian Pacific Islander Medical Association, National Medical Association, AAMC, American Association of Medical Colleges. We had a couple Congress people there. And at that meeting, we talked about the fact that what the Trump administration was planning to do was to cut the budget, $400 million from the diversity in the workforce.
Oh, no.
$400 million. Okay?
Oh, no.
Okay? So, but this is the money that's in there to enhance careers for students in health careers, okay?
Mostly coming out of HRSA.
Say again?
Mostly coming out.
Well, it comes from various places. HHS, HRSA, the Title 7 Act, okay? Now, I'll have these slides available to all the folk here. I'm going to ask Dr. Roy. In fact, you have that on your system yet? But I'll give her all the slides so she can kind of share it with.
I have an idea we can discuss after this.
Okay.
Yeah.
And my
with,
master's project was on that topic.
Really? So you can, in the discussion, if you would, I've asked Dr. Broadnax to really target nursing careers with this in mind, okay?
And nutrition careers, which is why I'm here.
Correct. Okay. So those, what is your name?
Well, mine's John Ojoyfo,
Right.
and I think I was just looking at the topic and I came here because I'm actually the program director for health workforce diversity at the National Cancer Institute. And all what we are saying,
Yes.
we actually dropped the budget, and
Yes.
we have, I'm actually in charge of the K08 and K23, which is involved in clinical and medical aspects.
Correct.
So, yes, I'm aware, and I don't go there,
Yes.
but
Yes.
I give the information to my
That's
boss.
Yeah.
In fact, he is coming to talk with us next week, Dr.
Good.
Howie, after Vamos left.
Yeah.
So, yeah, I'm aware of this, and that is why I was saying that for the population that we're talking about, who do not have
Yes.
generational wealth,
Yes.
That's right.
Right.
who do not have access to
Right.
this sort of thing, who do not have parents who are in the field,
Right.
the challenge is greater.
Right.
And so we are actually quite disappointed because actually with the discussion, we thought that the historically black colleges discussion will go further. Unfortunately, it was
Can I
not.
ask, could somebody take notes? Can you take notes, please?
So
This-
it was-
This is some very valuable things that we need to capture. I
Right.
appreciate
Let me
that.
get it.
So
I
what
actually
I'm-
have some ideas.
So what I'm
along that
saying
line.
is that, yes, careers is very important, but we've been saying this for years.
Yes.
It has not received any traction. Now we are cutting away from it. What do we do next?
Correct.
And I have to say, our message has generally been splintered.
Wow.
We have not had a message that is
Consistent.
consistent and will gain the attention. You know, we can recite numbers, but numbers don't have meaning because we're overwhelmed with numbers. We need to have something in our message that will gain the attention and retention of the information with those who are decision makers. Because I have been involved in 3 separate organizations going to the Hill, going to the Hill, going to the Hill. So what? They hear us march across there and say something. But what impact, as you have said, is it going to make? It's not going to make the impact that it should. We keep reciting the same numbers, but still the same numbers. Oh, here they come again. Oh, here comes someone else.
How much was the quantity you said they went to?
$400 million.
400 million.
And
So-
we think, well, and this was, understand, the day that we were testifying on the Hill.
I
March
wasn't
6th
with this group.
Right, March 16th. Now, that was the same time they were cutting $880 billion with a B,
Yeah.
$880 billion from Medicaid, okay?
So I want to give
And-
Trying to get, yeah, the-
Okay? And at the same time, they were going to approve over $800 billion in tax cuts for the wealthy, over 75,000, okay? Taking money from the Medicaid program and giving it to the rich, okay? So the fact that we were able to prevail with the help of a lot of committed, interested people, okay, we were able to preserve Obamacare. Obamacare is the law of the land, and whatever the Trump administration comes out with will be a tweaking which is needed. There are some things needed to help, okay? But I think what we need to do here is emphasize how critical it is for us to preserve diversity in the workforce, okay? And we do that by, first of all, assuring that the Office of Minority Health is still in place to assure that that money needed for the Cancer Institute Office of Diversity is fully funded. And this is how we do that. So I think from this panel, I would hope to have some recommendations on whatever you see as appropriate as a panel, speaking to the need to preserve that. I think that's an overarching thing that
Yes.
we could agree with that as consensus. Yes, you had a point.
Yeah, my point, so part of my background, so I'm trained in nutrition, but also health communication, and
Right.
having been a former recovering pre-med where I was in AMSO, we did the whole students
Right.
walking white coats,
Right.
how powerful that is. So I'm passionate about this topic. I could talk forever about it, but one of the things that I think about is campaign strategy, having worked federal and local government, understanding
Right.
the important role of grassroots, having the faces of children who represent the future, doctors, nutritionists, and being able to tack on the whole if Black Lives Matter, Black Health Matters, knowing the numbers that mostly minority people, professionals work in minority communities. So how important it is to even like making, just with the tobacco settlement, like making impact locally to get to the national. That was another strategy. So if we can't get nationally, where is the traction happening at the local level with the chapters galvanizing Black professionals together to make that happen? Because one of my issues, as I've been a part of the Academy of Nutrition Dietetics or whatever, and the local group, it's the last plantation. They're racist. I'm just going to call it out like that. We are not able to make the traction in nutrition and fighting obesity and diabetes because we lack diversity and leadership in the academy. Therefore, I splintered off, created my own group called WANDA about how do we get parents, teachers, healthcare providers. We're basically going to have to pull other people besides health professionals to care about this issue and seeing their intersection, that if you have a child who doesn't focus in class because they're eating junk food and the problems with dental caries, like telling the full story of how all these professionals matter and getting allies to be a part of a grassroots movement and being able to make that case to elevate it to the next level. I mean, that was the strategy that happened with the tobacco issue when all of Mass couldn't get it done and they just went county by county, province by province.
What you're saying is so critical because the indivisible movement in this country now is based just on that. It's grassroots organization.
Right.
Where, for instance, your program, like I serve, I'm PCP liaison in the core service agency, and every Tuesday we have a group talking about the need for good nutrition. We have a lot of folks with mental health problems, got some diabetics, a vitamin D deficiency guy, and all that. So that group, we need to know about. You need to come, and I think we need to come together. Those
Like
of like
coalition.
mind need, and this again is, I think, one to really focus our resources when I say the Office of Minority Health, because what the Office of Minority Health does is make sure we have conferences. They have a resource training program. And so, sharing what opportunities are available in nutrition careers, I think is the kind of thing. And I'm going to stop here, though, and ask Dr. Broadnax if she would go ahead and tell us a little bit about how would you pick up on, like, I know in medicine, we have fewer American black males in medical school now than we had 10 years ago, okay?
Yeah.
It's gone down. And nursing, so would you take it from there,
Sure.
Dr. Broadnax, in terms of,
At this point, in all, we have over 3.1 million registered nurses in the United States. Okay, that was the last count. But what we are finding in the year 2020 is going to be mandated that all registered nurses possess a BSN as an entry into practice. Well, what we're finding now is that
okay?
minority students are gravitating to community colleges. So while they are getting an education at the associate degree level, the profession is mandating that you have a BS to be a registered nurse.
They're trying to move it to master's.
So
at the nutrition
in your class, in your profession. So we need to have, along with what Dr. Fedget has said, the funding to support students obtaining first a career in whatever health profession. I'm a nurse, so I'm going to say in nursing, but also that they are able to go to the next level and obtain a BS. I do recruitment. I talk about nursing careers all the time. In one program in this local area, the education is $4,000 a semester. This is to obtain a baccalaureate degree. At another program across the street, it's $40,000. So who can afford that? And even as I go out and try to recruit, are students making a beeline to my program? No. What is the holdup? I don't know if they still don't understand as much as I present, as much as I have educated my colleagues. I mean, anyone that I come in contact with, I said, anyone you know who is a registered nurse, ask them, do you have your BSN? Ask them. Invariably, they'll give some excuse. No excuses, because I believe, it hasn't been said, but I believe the next step is going to be mandating that you will have your BSN, or you will not even be a registered nurse. Or it's going to be required that the hospitals have X percentage to be open, to be licensed, to have your Joint Commission accreditation. It's coming.
And the other deeper conversation is, so my other role is health chair for NAACP DC branch. The national office came out with a report on diversity and leadership in healthcare, because it's not enough just to have healthcare workers being diverse, our leadership. And so also what this means and how to make our conversation relate, because in our Black community, health honestly doesn't really seem to matter too much. That's been my feeling, but the things about jobs matter more. It's the whole hierarchy of needs, right? So the moment we start switching our conversation to economic impact, how we're creating middle-class jobs, because ultimately people with healthcare professional degrees are part of the middle class, then it becomes one of those situations like, oh, ears might open, because now we're meaning more money in the pockets of our community in order to invest in future businesses and be the stewards of our community. And that's basically what folks around the table represent. That's the power of education and the power to give back to our community in economic and health impact ways. And that's the part to pull in other folks who want to only talk about jobs, which is mainly government, and policymakers that represent like Ward 7 and 8. That's when they start making the shift in conversation when we're talking about jobs.
But you know what I do, Dr. Fedget is well aware. I believe in strong collaborations. Whenever I have any opportunity, I call my buddies, I call my friends across town, because we need to speak the same language. know the same information. If you ask Dr. Faget about nursing, he can spout off his elevator speech.
Whatever you taught me.
That's what I've taught you the truth, so you can remember. If you ask me about medicine, the biggest thing I'm going to remember
Yeah.
is the decrease in diversity
Yes.
and the decrease in enrollment of minority males in medical school.
Expulsion,
It just-
dismissal.
I hadn't got to that part, but they haven't even started. So I'm going to remember these key things, whoever I speak to.
Yeah.
So when we're out there doing health screenings, we act as a team. We role model for our students. We demonstrate what is the role of physician, but also what is the role of the nurse in partnering with the physician. What is the role of all of our health providers in providing this care? We have the nutritionals.
Which brings in the concept of, the training concept of IPE and IPT,
Yes,
which is.
but that's la.
Yeah.
We do it. We actually are doing it. I mean, we can take what we do and build a model because we firmly committed to what we do. And even when people come in, we bring the people from across town, they enjoy, but I'm not so sure they get it like we do. Because you can see our students, we have RN to BSN students. So the students collaborate with Dr. Faget. He shows them how physicians and nurses work together to improve the care of the community. I don't have a nurse practitioner program, but we see the role of the nurse practitioner. All of this is role modeling to build a better, healthier community.
Right. And I'd like
I have an idea.
I'd like to hear from nutrition now. Dr.
From where?
Fungway is a nursing and allied health science at Howard University, and the role of the food scientist. I
That's
think,
right.
how many,
Yeah,
how
that's
many
what
of you
he
have
wanted.
heard that?
He
Okay.
wanted me to talk about that, but unfortunately, I'm a food scientist by
Right.
training. I'm a nutritionist and a food scientist by training. We don't have, at Howard, we don't have the food science aspect of it. But we kind of like introduce that into our individual research programs. Because as you know, there's a lot of myth. Well, some of it is myth, some of it is real about food processing and foods that are supposed to cure cancer or other diseases. And so just listening to you all speak here, the reason I brought up the interprofessional education thing, which you all practice, is that from the education point of view, we have problems getting our students into internship programs, which would expose them to, interprofessional education. And so, what I look at is how do we harness all of these programs. I was involved in a community participatory healthcare program in Mississippi for about 2 years or 2.5 years.
In Jackson? What part of
Mississippi, all the way down from Vicksburg down to Biloxi, all those areas down.
So you did some time at Jackson?
Yes, I did some time at Jackson. I was actually consulting with the Jackson Heart Study.
Okay. Thanks.
For that time frame. So what we are looking at is how do we harness that into policy? Because I know when we started that program in Mississippi, eventually it was killed because they said it was too expensive. But I thought the success that we made,
It's expensive because it's helping black folk? Or?
Yes,
Of course.
which is consistent with bending the arc that we
Of course.
think yesterday.
I say that because I was involved, National Institute of Child Health Development, we put a health education kiosk in the middle of Malcolm Mall. You remember Aaron Sherrill?
Yes.
Okay, I'm telling my age now because he's a colleague and he's dead. So
because he's a survivor.
You're living in the spirit.
but that was such a robust Malcolm Mall community. The Jackson Heart Study is really that's a good area that, for instance, my buddy, Dr. Fred Martin, I went to see him up in Walter Reed Hospital, and his sister had brought him pig's feet to eat, okay, while he was getting his 8th stent, okay. I said, Fred, if you eat less pig's feet and meat, you probably need fewer stents, okay? But I think it's such a, you're right in it in terms of showing the impact of nutrition. And I think these are the kind of collaborative things that we need to share with the youth. So if you go into nutrition, you're already going to be helping heart disease, You'll be, like a heart surgeon. Because we do know with, we had a talk in my church, and they had a patient on a vegan diet for 18 months. He initially had significant cardiovascular disease, coronary artery, plaques and all that. 18 months cleared.
Yes, yes.
Okay. So I think,
Yeah, I'm not surprised.
and that's why, what you're doing is so critical to get more nutritionists in the system. That's what you're saying?
Exactly. And we need them because when you look at, there are about approximately, Howard has trained about 110 or so PhDs.
So would you say it's trained the most PhDs in nutrition than anywhere in the
Than
US?
anybody else.
So it's kind of
Because
like
it's
what,
black.
Yeah, about
So it's like
90.
the Xavier, if we know the
Right.
role of Xavier in training
Yeah.
the most black MDs.
MDs,
Correct.
exactly.
Yeah,
This
pre-med.
is the training the
Yeah,
most
pre-med
black
program.
heart.
So if Howard has trained 90% of those PhDs,
What would happen when the doors almost closed?
Exactly.
And that's why
And
that bad press, I got
ideas
the
should
Washington
come
Post article on Howard University was
Yeah.
designed, it's yellow journalism. They were talking about cases from 2006. Okay, I was the medical director at the health department. The case they cited in there about Rosenbaum, who died and all that. So that was not Howard's fault. And in fact, they came to me to sanction Howard, just to give you an idea how they work. They wanted to use that case to close Howard down back in
Oh, my
2006.
goodness.
Okay? And the same racist people are bringing it back up because they want to bring a new hospital into D.C. Okay, so they have to wipe out Howard so they can open up the certificate of need. Understand how this works, okay? Closing diversity programs,
Right.
okay, decreases black folks, so that more there, other
Their folks,
okay,
yeah. Right.
non-black people take those slots.
You got to call it what it is.
Okay, now I think that's we got to. Thank you for bringing that up to start with, because let's say it. It is what it is.
yeah, it is what it
Yeah.
is. But in fact, I had an idea.
And it's not so much its existence, but our reaction to it. What we're doing is talking about a
Yeah,
positive
healthcare is
approach.
a human right, and it's something
But you know
to get
what?
Right.
The one-
Healthcare is a
one-
human right.
One-
Let our panel, can our panel have a consensus on that? That we are very strong,
Declaration being
that part of assuring diversity in the healthcare workforce is a step towards assuring that healthcare as a
It's a
human
human
right
right.
is realized. Is that a fair statement?
One thing
for our
I
panel?
don't want to be lost either.
Okay, I'm
is-
on soapbox.
Sure, I know. I've been here long enough, okay? But I don't want to be lost.
Good.
We have to role model and push our
Good.
students to learn the importance of not just advocacy,
Yes.
but right.
Right.
Right. yeah.
Not just marching, but
Yeah,
right.
and standing up for it.
I mean, no, W-R-I-T-E.
Yeah, right.
You know, right, because we talk about,
Yeah.
Oh,
contact your congressman. No, we talk about contact your congressman. But I had students, and I said, right, was doing, this was
Like
this
impact
repeal, and the repeal of the Obamacare was a good impetus to get students involved. Write your congresspeople. See, my students are older, so they had representatives, they
Right.
vote. Show them you must write. Show them you care. Get an email,
Right.
however you.
Don't just be a
But
recipient.
just write.
And that-
Write. Let
and-
them know.
and
Not
when you-
form letters.
Right.
No
Right.
form
And
letters.
when you write, the data that, I got to pronounce it, Dr.
Fungway.
Fungway.
Right.
The kind of
Tell
data
me a
Dr.
little bit.
Fungway and Dr. Broadnax have mentioned, that data is very, very, the way we kept Obamacare, we told them that if you cut, every dollar you cut from Medicaid means $1.33 out of that state budget. In D.C., if they had repealed Obamacare, it would have cost the city budget $621 million out of our budget to continue the care. So I think the data, writing, but having the data,
That's right.
good data to support your position. I'm sorry. Did you?
And that's part of the problem with, that's hampering the Howard Hospital now,
That's right.
because of all those budget cuts
Budget
Right.
cuts, yeah.
and the gentrification of the
Yeah,
neighborhood.
that's right.
So Howard gets patients
who should have seen a doctor last year?
All right. It's adverse selection.
And
by
the
definition.
adverse, and
Exactly.
they get the really serious.
Right,
needs.
we got an expert here from.
Well, what I wanted to find out, because as I said, I sit at the National Cancer Institute, and my understanding is strategies to increase the workforce diversity.
Yes.
Yes, I have one.
That's my role at the National Cancer Institute. That's the role of Hannah Valentine
Right.
at the National Institutes of Health.
Right.
And that is what Harold Vamos has been advocating. And
Yes.
that is what Francis Collin is offering.
Yes.
My question now is policies, because you mentioned the National Minority Health.
Correct.
The National Institute of Minority Health and Health Disparity
Yes.
Yes.
is the front
That's in the
institute at NIH
Right.
for the DHHS
Correct.
that is responsible for this. So when some of us come to this type of forum, we would like to hear ideas that we can take forward and put in. I'm a low level, but
I have an idea.
but what I write
Yes, right.
goes up to the top.
Yes. Correct.
So what I want to hear, because without giving you much history, I have been part of the educators in this community for a very long time. I've been here for over 37 years. I've been at Howard University, and I was still again there last Monday, and I have followed what has been going on at the Congressional Black Caucus with Howard University. What is just mentioning now about what is happening to they want to sell the hospital. Well, what happened to Georgetown will happen if they don't see the experience of Georgetown with Mester. I was at Georgetown for 1986 to 2008. I know what happened there. And I also was from 1996 to 2002 at Howard University. So what I'm saying, what I'm trying to get out, and not to relate it to what strategies do we develop. It is true that all these health-related areas are very, very vital to our health, to the communication, to what we interact. However, except we develop appropriate strategy and prioritize them in such a way, because we never have enough money to go around at one time.
Right.
I have
That's
an
why,
idea.
that's why I think it's very important. We, in March 16th, were able to really fight and preserve funding for the diversity health workforce. Now, the National Institute of Minority Health and Health Disparities, some of their target areas and things I think this panel should support, they support minority university training for biomedical research, medical school grants for research on minority populations, centers of excellence, and faculty and research development. Those are very key areas that this panel needs to cite as things that need to be maintained in the budget.
Yes, I agree, but I also would like to
sorry,
add, I would
Right.
also look to add that there are different tiers, different levels. At the government side and at the institutional side.
Correct.
Because even when we are mentioning
Let
schools,
me submit, though, we need to fight for the federal funding so that right now, a lot of NIH money goes in the institution and something happens at institutions sometimes.
Well,
okay,
that's
with
one
the
side.
research money. What I'm saying, though, you got to have federal oversight, especially, well, I say that.
have an
See,
idea.
now let me preface that. When I say federal oversight, I'm talking about Obama presidential kind of oversight, not this mess they got right now. Okay, be clear.
yeah,
So-
before this, what I'm saying, that
Right.
before this one came in,
Right.
there have been Obama
Yes.
for 8 years.
Yes.
And money was earmarked for certain institutions.
But you had some institutional
So
racism
what
that
I'm
blocked
saying,
that.
well, I agree with you, sir, but
Yeah.
what I'm saying is that, because you mentioned something now, and I think we don't seem to look at, because I
Right.
also am part of the team that manage pipeline,
Yes.
not only at this PhD
Right,
or
right.
master's level.
Great, good.
Because you brought up some statistics that the number of medical students have dropped. But if you go back to how many of our students in K through 12
That's right.
that are actually progressing. Because if you look at the educational status, how many Hispanics, how many compared to African Americans, compared to Asians, I have been following it, in fact, for a long time. The number is decreasing of people in the education. Not even at the medical level, even getting
So what are you?
BSc. What I'm
What are you
saying that
looking at?
Let's suppress
wait,
them
wait.
all.
Is it the math scores, science?
no.
No.
Everything from education. Look,
Education.
before education.
Education
from
period.
because no, if you don't get a good student at the K through 12,
Right.
you will not get a student
I get it.
Go
Right.
to
at other
They
level.
make them repeat.
So what I'm saying, sir, is that the money that is being available, yes, in general, we need more money.
We'll just if we keep what we got.
Okay, but the use of that effective use of those
Effective
money
use, yeah.
and how many of us are our training and everything, how we allow it, how we go out to bring the young ones
Yes.
up
That's right.
Yes.
is very important. And that's what I'm saying, because the greatest strategy now, if they bring more money and it's misused, it's still not going to help us.
That's
I have
excellent.
an idea.
Right.
And that speaks to your point, though, in terms of what we do, because a lot of
Strategy,
programs,
it needs to be
a lot of
strategy. You need to
programs.
know what's the program.
When you go in and look at the program, that program is so much more impressive when folks in there are funding it themselves and they're using their own.
Exactly.
Okay, and that's attractive because in having private-public partnerships, okay, and becoming dependent of federal funding. That's the thing. You can show some viability with what you can do at a grassroots level on your own. Okay, and so I think building on your initiative,
Right.
I think speaks to that, what
Right,
you're
sir.
saying is needed.
Yeah, and
Yes,
that's
sir.
why we
Absolutely.
created this character.
And
for
even
that-
in terms
that
of pipeline,
teenage
pipeline begins with parenting.
Good.
Okay,
But what I'm saying in the sense that if you look at where, see, they are cutting money away from certain things,
Yes.
they are moving money somewhere else.
correct.
Okay, how do we target where that money is going? For instance,
Yeah.
money is going to the military. Okay,
Well, yes,
but
yes.
you know that the military is one of the greatest proponents of education.
Correct.
DODs.
The DODs.
Correct.
There are many grants that are not funded at the NIH or something like that. But DOD, in fact, many of the program, prostate, breast cancer, they were the very first people to really force Congress to get money to them. So
Right.
what I'm saying is that strategies, not to
Correct.
talk on one thing, to look
Yes,
at,
right.
No,
let
no.
us
I
follow
have
the
one
money.
strategy. It's a little bit out of the box.
Now, why
Sorry, go on.
don't you,
Yeah, sure.
you had some thoughts. Let us hear.
Yeah, no, it's just a strategy, and it's to do with your Pan-Africanism. You know, there's a lot of medical tourism. India, Jordan, and recently Dubai. They get a lot of American patients, and they're able to offer medical service of high quality for maybe half or even a third of the cost. Is it possible, I don't know how this can go, but I know that the U.S. has also some clinics and some hospitals in developing countries. I know I worked in Togo at the Peace Corps Health Unit, and I know they have a hospital in Paris. Is it possible to have like a Department of Global Health that is affiliated with the State Department, where insurance companies can offer elective procedures for
Well, you have.
Yeah,
that
we
department.
have it.
You have a department.
We have it.
global, but
Yes.
then it's going to offer this type of service
Well,
we
for
have-
Africans,
Yes,
where
well,
they can choose
yeah,
to go
no,
to
no, we do
Ghana
have it. I was
or
with-
go
I was-
to.
I was with USDA.
Exactly, we
and,
have it
they-
for
they-
years.
So they can go
all
to
my- all
Ghana
my
for
employees I had to
surgery and
send
come
over
back?
to State Department.
Yes.
I think you're missing the point
No,
I'm
no, no,
making.
no, no. Do you know
Because-
that even from Bush era,
Yeah.
Bush era have actually organized
Right.
teachers, surgeons,
Right.
everybody going there, even till now.
Because you see, what I'm talking about here is the service cost is less. Like, for example, let's take stress testing, for elective stress testing. So maybe you pay 6,500, maybe for a complete workup. Here, in the Philippines, I have a friend of mine who's a doctor, and she was in the Philippines. It's $65.
Yes.
Now, if there's a health insurance that has members, then you can pay the air ticket and everything for the service. Maybe like it's even going to be a tenth of the
But you know-
cost,
you know
and they
what?
come back,
Let me just
and that will save
plug something in
money
there.
or no.
What the exciting point that she's making here is, like I said, we in Can Africa going to be rebuilding the public health
Yes.
infrastructure. But what's interesting is a lot of, you have increased maternal mortality because mothers who came to the hospital in Monrovia, but they didn't have insurance, they couldn't deliver, they go out in the bush and die
Yeah.
in childbirth, okay? So whatever we do, we need to train, as part of that diversity, we need
Locally.
people who can help us with the whole insurance issue, make sure we have the
US citizens.
healthcare administrators, the healthcare administrators, that's another area in the workforce that we need to address. I think that's a key point.
Right, I understand, sir, but
Right.
what she's saying about the global health,
Yes.
what we are saying is that because there are differential infrastructure developed at these various places,
Yes.
the India that I'm talking about, okay, who is a death trap for many of them. Trust me, there's nobody that goes there for any surgery or anything that receives good treatment.
That's
So-
why I was saying
So-
that what I was talking about was we do have U.S. clinics and we do have U.S. hospitals affiliated with the Department of State abroad.
Right.
Now, in certain countries, isn't there a plan where we could put where they could develop those, because your service is going to be lower, cheaper, because service is cheaper and of the same quality.
Okay, I see we can time as a
And
moderator.
then we can have
I wanna
collaboration.
make sure we capture that in the minutes.
Right.
I want that captured.
And we can get funding for that.
Correct.
Because
but
it's
I-
going to
but
save the government
that's a whole
money
panel.
over time.
You're addressing a whole new panel there. But I think what we need is diversity in whoever's running those things, okay? And you've got a lot of
It's a diversity.
U.S. programs that are not well, has no diversity in them.
I know.
So that speaks to, again. So if we can go around now and just get some final recommendations. I think let me just say that one of the overarching thing our panel has said is healthcare is a basic human right, and we think that you need to maintain diversity in the health workforce to assure
And
that
leadership.
right is due. Is that a fair statement?
Right.
You accept that?
Including the leadership.
Okay. Now, what's the second? Give me another. Do you have a recommendation that we need to make to the larger group as a panel?
I echo the point about investing in the early years of exposing
Our
all the
children,
prereqs to become health professionals, and why we created, the concept of Where's Wanda to start having that exposure to kids early on.
So it's part of the pipeline.
Right, investing
Right.
earlier in the
Pipeline,
pipeline.
yeah.
Yeah, because I know the USDA actually, I mean, the U.S. Department of Agriculture actually invests a lot in that pipeline.
So you think,
Unfortunately, their funding is not even a third of
well, it has to be sustained.
NIH, it's
have
not
mentorship.
sustainable.
Sustainability is quite an important point.
True.
And that is why I used the word develop strategies with priorities to be able to evaluate
That's right.
progress.
Critical.
so we mentor, volunteer
Well,
mentors
it doesn't
at
matter. All
school.
those who come under all those strategies.
Strategies.
Whatever strategy strategies and prioritization that will enable us to evaluate where we've been, where we are, and how we can move forward.
Big government, yes.
Because all the things what we are saying, they are just little things underneath.
Exactly.
The overhead thing, including misuse of
thinking.
funds, including lack of direction, including lack of strategy. We heard it all of us are speaking in different languages.
Right, right.
But if we say, oh, this is nurse, this is medical scientist, this is this, and we are beginning to talk in our own little silos, without
silos
an
mentality.
overall objective,
Exactly.
we are going to be dissipating our energy, and people are going to be using divide and conquer.
That's right.
Right.
But
Go
I
ahead.
don't
Dr.
want it
Burns.
lost about the collaboration versus competitiveness.
Correct.
This is not necessarily a strategy as much as it is a behavior and a change in mindset. Because do you want to give more money to the Hispanic Medical Association or to the National Medical Association or to the American Medical Association?
AMA.
No. All of us are going to
Exactly.
suffer if there are changes to the Affordable Care Act.
Yes.
Period.
So we as a panel see the maintenance of the Affordable Care Act is a key component
Right,
to
that's
diversity
number
of
one,
workforce,
yes.
okay?
And then strategies to maintain that, to hold on to that, and then for us to
Because what,
speak with one voice.
because
That's right.
let me make
Speak
a point
with
here.
one voice.
Let me make a point here, because what's happening, under the Affordable Care Act, the also minority health, at all agency levels is funded through Affordable Care Act.
Yes.
Okay, and we're able to keep that.
Yes.
So that's something we need to continue. That will help us do what you're saying then, right?
Yes, but the CMS, and this is where the divide and conquer comes in. The CMS, when they do something like
That's
that,
right.
somebody comes in, who is it depends on who is at the table.
Great.
That's right.
Many of us are not at the table, and that's why she was talking about leadership, which I agree.
Right.
Training is one thing, leadership is
Leadership.
another thing.
Right.
And I think I agree with her.
Right.
And if you,
And we need to research any successful stories, because when you're asking for money, you have to say
Stories
this.
work.
You can Google.
Yeah,
Now, could I-
we've done this and this successfully and this and that, yeah.
I'd like to ask a very specific recommendation to the nutrition, because I think that is such an overarching.
Specific, yeah.
It's
Oh,
a- Can we,
y'all support that
I think
effort.
that if we can highlight that as a career path.
Critical.
Just to show how important nutrition is in
Right.
terms of the total.
And NIH can be a big
You would be the
sponsor
best
for that.
person to give a recommendation
Yeah,
for that.
see, you're so right, because nutrition is, you talked about your son,
Yeah.
pre-med. What many students don't know that nutrition.
Now, he said son because it's going to be a
it's a
doctor.
woman.
Your
But it
grandson.
happens to be a daughter.
your grandson.
He's a master. not master, he's a, how do you call that? Sexist.
Thank
that's
you.
right.
You make me look good.
Well,
So
Yeah, there's a human nutrition.
nutrition is a
option.
pre-med also.
Yes,
Right.
And we do
that
have
needs to be
a
emphasized.
number of our graduates who end up in medical school.
Correct.
They're better off.
Many of those in the
Indeed.
traditional pre-med program don't realize that.
And that's a good candidate for MD, PhD.
Exactly.
That's
and
right.
and
That's right.
most of them success,
Like
they're much more successful in getting to
MD,
medical school.
PhD.
Because
He's
they
very
have more
modest.
kind of like career.
well,
We
what
need
I'm
more like you.
What he said, see, I have always thought, in fact, that is why I went to do my PhD, that nutrition is the basis of health.
Yes, it is.
Let your
It
food be
is.
thy
Every other thing, and what I said today, all the health illness that we have is because of bad nutrition, either in the processing, or in the timing, or in the way. There are so many
lifestyle.
aspects. It is the basis of health. It's the basis of cure. It's the basis of everything.
It's true.
If somebody ingests something and you don't pump it out, it's good. So
And one of the critical part that I was probably going to mention if we had the formal talk was in the field of microbiota, which is one of the newer areas coming into nutrition. What we eat,
What new?
microbiota.
microbiota,
Gut
microbiome.
The new frontier,
Microbiome.
your gut brain.
Well, it's not the. Anyway, go ahead.
Well,
And for the average consumer,
Yeah.
it's new frontier.
it's becoming clear that
You've been in the game.
what you eat, it's becoming
You are
clear
what
that
you
what
are.
you eat, affects, the microbiota.
Right. Well, that's true.
And that by itself leads to whether you are generating free radicals
Right.
that are pretty much underlie a lot of chronic ailments.
Well, actually, it's the
Inflammation.
candida in our gut. The balance depends on the amount of potassium and sodium that you put into the system. Okay, so there are so many things that can interrupt with it. So, I mean, we can talk from there, but every part is very vital. This orange, if you remove it, as we are doing, and go and put it into orange juice, it becomes useless.
That is true.
So, nature has made it whole.
That is true.
The same
which,
way that
which goes back to vitamin
what
C.
we are saying,
which I was
everything
going
that
to talk about.
exactly everything that we are talking about, we are all part of a whole.
That's right.
Yeah.
So we cannot
And
begin to
those
say this is more
vitamin
important. I
tablets
agree
are
that we have to
effective.
identify everyone. else.
No, what I was leading to was the fact that we have the STEM program, which pretty much concentrates, mostly
What's the recommendation?
engineering. My recommendation is that we look at the diverse field in the sciences,
That's right.
rather than trying to define who goes to medical school and who doesn't, because all of these courses are interwoven. Like you said, nutrition is a critical component of our health. They're all interwoven. And so if you look at training, introducing,
Holistic.
kind of like holistic training, introducing nutrition into all of these fields, medicine, you name it. We'll find that we'll be able to generate healthcare providers.
It should be integrated into the curriculum.
integrated into the curriculum. Yeah.
And my other recommendation to that point is looking
Quantum
at,
physics too.
since Dr. John's role is kind of like represented as diversity officers that we need across sector, the other component is really an interagency, government-wide diversity meeting of the minds on, just like we look at corporations, how are you diversifying? I think Kellogg and a few other foundations are great examples of how they look at 360 form of diversity. Is not just what leadership looks like, it looks like in terms of how the grantees, what they look like, the impact in the communities, what that look like. I don't want it to get lost in this conversation because I've seen the Oreo effect, and I'm just being so not PC because I'm not in government, I'm not in politics. But what I've seen even in nutrition, we have black faces, but we're still pumping out white information. That is a problem within it. When it comes to food and culture and identity, so intricately linked, and with me and my interests around Pan-African food and nutrition issues, the diversity also needs to go into factor into the, as you had stated, the curriculum. What are we teaching? Is that being reflected in the culture of the food of the community, and making sure that is part of policy and programming that's supported with funding.
Well, how's our time? How much time we got? No more time?
No more
There's
time.
never been time.
Okay, can
It
you
has to be
can
continued some
can you
other
read
time.
back our recommendations to this point?
Okay.
You want recommendations from us? Are we going to give
Basic-
recommendations in a bigger group or what?
Well, they have 2 minutes break now, so they have to be an extra 2 minutes.
Say again?
They have a 2 minutes break right now.
Yeah.
So they have to be an extra 2 minutes, and you guys have to join them.
Okay, I'm saying, do
Okay, let me
we need to give
Are
a...
we going to be speaking to the people?
I'm
Yes or no?
sorry. I didn't
Yeah.
Are we going to speak to the people or not?
No, they
If
hadn't
we
been.
don't, then-
Let's just have it just in case.
Well, we're getting our recommendations together. We had such valuable input here, we want to capture it. So we'll have something for you.
Okay, sure. Thank
Okay?
you.
All right.
Sorry, I didn't get my question.
That's
Yeah, no
okay.
problem.
Okay, that's okay. You've
I
done a good
mumbled,
job. You've done a good job so far.
And
to
the
be working
reality
so
is,
hard.
we have to keep this
Yeah.
conversation going outside of this room.
Yeah, let's make sure everybody's got everybody else's cards. Right. I ran out, so. Dr. Broadnax be my contact. I work for her.
I don't have my card, but I'll email.
If you can make a list
the
of
ones that
everybody.
I have, yeah.
Since you have the computer today.
I have.
Can you read back the recommendation?
Okay, the recommendation is, one, basic human care is a right.
Yeah, healthcare is a basic human right.
It's a basic human right.
Right.
Healthcare is a basic human right.
Okay.
And we need diversification in leadership, and then we need to invest in early years to produce health professionals, and that's the pipeline. And then collaboration versus over competition among
Within the health
within
careers
the-
of
that's right.
professions.
And then nutrition is the basis of health. So we need to we need to integrate it. Need to have a holistic with the physical. Is there anything I missed?
Training that the training and
Holistic.
the nutritionists will need training or workforce
Management leadership.
leadership in that.
Yeah, I think I said leadership. Yeah, basic. Well, let me
Yeah,
put it
basically
here
to
as well.
ensure that the number
Leadership.
of
Diversity. and
Diversity, yeah, we need to do that because there is systematic targeting of minority, and it's not even hidden. It's not even blindsided. It's purposeful.
And I'd like,
Yeah.
and do we have a specific recommendation? Any other
And
wording
his
you have for-
recommendation was holistic. I mean, I was trying to get. I don't know if you have any specific thing to make it holistic into the medical curriculum. Did you say anything else
No,
different from that?
health professions.
Health
In the health
professions
profession, yeah.
curriculum, yeah.
In the health profession, that's what I have. Holistic in the health profession curriculum.
Okay. Anything else in nursing?
No, my thing was still, as we strengthen the curriculum of each profession, we will build a stronger health,
Yeah,
Let's come-
collaboration versus competition. And we need to, it's the paradigm shift, so to speak.
And I'd like to get one final statement. You were talking about developing could you restate that? Developing
Oh,
strategies.
that our policy need to develop strategies
Yeah.
with priorities to move forward in such that is to guide us in the development of this workforce. Because down the road we need that policy or that strategy or policy need to include developmental evaluation so that we can begin to
So what you're saying is we need to have specific,
Right.
this
Policy.
goal, and then this
Okay,
method, and
then-
then
and
this
then
output.
let me say that I wanted to hear that because I think we need to marry that with your statement that it needs to be about making it very we don't get involved in the process. I see so much time spent, and this is sometimes these processes block progress.
Yes.
In terms of making the change we want.
exactly.
So whatever we develop, it's got to be lean and mean, geared towards increasing diversity in workforce.
Right.
Is that a fair statement?
Time.
Yes.
Okay, and we need to design
We
it.
Say
need-
that again.
Exactly.
Not letting other folks.
Almost like a
we cannot-
diversity audit.
Yeah.
Yeah, that's
And we cannot let
it's a
other
strategy
people.
of policy that
Right.
will
And it's
gear
time.
towards
I think it's time now to not let other people define us.
exactly. That's
We tell
that's-
Yeah, we
what
did,
it is.
yes,
Exactly,
yes.
like we make
They
report card on
assume.
them. We're
Hello.
the
Yeah.
watchdog on
Okay.
them on diversity.
Okay, but like I said, I think when they ask for a report, though, I might call on each one of you to.
I'm not able to expatiate
Right.
on this report. Yeah, that's true.
Okay.
Because sometimes,
Okay.
just if we don't capture,
Right.
somebody
Yeah.
can add to it.
Right. Okay. So will you and
Email. So I have,
get a report, then we